This slide here now shows us the continuation of the vertebrae. So we have been discussing about the vertebrae and specifically the different types of vertebrae, and this is the first one right over here. So what is shown here in this slide particularly is the types of vertebrae here, which is the first one here, your cervical vertebrae. So as you recall, from the most superior to the most inferior, you have the cervical, you have the thoracic, you have the lumbar, the sacral, and the coccyx. So this is the vertebrae right over here, from superior to the most inferior part of the vertebrae right there. So the first one here would be the coccyx right over here, which have a total of 7 cervical vertebrae. So the first one here have a special name for it, and this is what we call the atlas. Okay, first cervical vertebrae, and this is the one that holds up the head. So this is kind of like the named after the Greek mythology god Atlas, which basically have his shoulder around the have the earth on his shoulder, so carrying the earth on his shoulder. So that is what we have right over here. So that is the Atlas. So this Atlas here will permit us the movement of our head, permitting to say the yes motion of the head. So when you bob your head up and down, that's basically the Atlas at work right there. The next vertebrae here, the next cervical vertebrae here, this is now your axis, your second cervical vertebrae. And this is named because it rotates around the long axis of the body when we shake the head no. So when you are saying no, then you are basically utilizing axis or cervical number 2. The rest of the vertebrae here, we have the thoracic vertebrae. So this one right here will have 12 of them, all in all, 12 thoracic vertebrae. And then the lumbar vertebrae, which is going to have 5 total vertebrae here. The sacrum, there are 5 individual sacral vertebrae, but fused to become one, okay, after birth. Okay? The coccyx here have about 4 or 5 individual bones that is also going to be fused after birth. So that is the total number of different vertebrae that we have over here. And in between the vertebrae, we now what we call the intervertebral discs. This is a type of fibrocartilage. So do you still remember when we were talking about the different types of cartilage? So this is the a type of fibrocartilage or composed of fibrocartilage, our intervertebral discs, that is now going to prevent the vertebrae from grinding. So looking at this figure right here, this right here is the intervertebral discs, and they are inserted in between the vertebra. So this is a vertebra right over here, this is another vertebra right over here, and then another vertebra right over here. So as you can see, we have three vertebrae right here that is sandwiching this intervertebral disc, and these intervertebral discs right over here prevents the grinding of this vertebra right here to the vertebra over here, or this vertebra right here to this vertebra right over here. In addition to that, these intervertebral discs, they are also going to absorb shock when you are running, jumping, or even when you're walking. So let's say you jump from this ledge here to this floor right over here, and as you jump down this way, right, so you will be putting pressure basically on these discs. So I just put here ID. Okay, so this intervertebral discs, that's the one that is now going to be absorbing this pressure right here applied to the vertebrae. In addition to these functions here, it also allows the vertebrae to move as we bend forward, backward, or from side to side, right? So when you're bowing, for example, right? So that is bending forward. So when you are hyperextending, so when you're extending your back, that is bending backwards. And also when you turn from side to side. Unfortunately, as we grow older, these discs become weakened, okay, with age, and they can ultimately herniate and also rupture. And the pain pressure here, if the disc presses against the spinal cord or the spinal nerve. So what do we mean by that? So the discs would look something like this. So this disc is composed of two things. So this one is the disc here, and we have two parts of it. Okay, so this is the interior, and this is the exterior part right over here. So try to recall the name. So this one would be the nucleus pulposus, right? And this one right here on the outside part, this would be the annulus fibrosus, right? So those are the two parts. So when it herniates, okay, or rupture, so this is what's going to happen to our disc. So now we have something like this. So this is the outside portion, and now you have something like this. So now you have the nucleus pulposus that is actually herniating out this way. So it's no longer intact as we see it over here. So when this happens, now this herniation right over here can actually pinch on a nerve. Okay, so this herniation right over here can now pinch on a nerve, resulting in a pain, right? And oftentimes what happens is when this does happen and you are complaining of back pain, so this is your clinical correlation here. So when you are complaining of back pain and the physician asks you to pinpoint where the back pain is, and oftentimes the most common herniation here is the lumbar. Okay, so the lumbar region, this is the most common part where herniation occurs, right? So from here on, this pain at the lower back, basically, right? So this would be at the lower back. This is now going to radiate. So what do you mean by radiate? So the physician will ask you, okay, pinpoint to me where the pain is. Next question would be, does it radiate to your toes? What do I mean by radiation? So if you have ever hit your funny bone, for example, and you feel that shooting pain going to your pinky, that's the same pain as this herniation is going to bring about. The difference is that when you hit your funny bone, which is actually a nerve, by the way, right? Now it's going to go away, right? Give it some time, it's going to go away. This herniation right over here, this pain tends to persist and does not go away. Now, can you imagine that, right? So pain that's just not going away from your lower back all the way down to your toes. All right. So continuing on here, let me just take a look at the figure here showing us the different parts of a vertebra. So this one right over here would be the body of the vertebra, right? So this is the vertebral body right here. And then this one here is your superior articular facet. So this part right over here is going to articulate with the one above it. Or in other words, this superior articular facet right over here, it's going to articulate with the inferior. So let's see, let's take a look at it over here. So this one right here, okay, so this part right over here, this would be the superior articular facet of this second vertebra. So I'll just call it second vertebra. So this is the first vertebra, third vertebra. So this is the superior articular facet of the second vertebra, which is now going to articulate with the inferior articular facet of the first vertebra. Okay, so this superior articular facet here of this vertebra is going to articulate with the inferior articular facet of the vertebra above it. So that's the one that we have over here. And then there's another one here. There's another facet. This one right over here, and then this one right over here, or this one right here, and this one right here, and you guys get the idea. This is where the ribs actually attaches to. Okay, so articular facets for a rib. So since we know that this is articulating with a rib, we know now that these vertebrae right over here comes from the thoracic region. Okay, so that is the thoracic vertebrae right over here, because only the thoracic vertebrae contains articular facet for a rib. That's unique for them there. And then we have the transverse process here, the one that goes out, and the spinous process. This is the one that actually goes down towards the back. And another one here is the vertebral canal. This one here, this is where the cord is actually, the spinal cord is actually going up and down. And you see this one over here, this is known as the intervertebral foramen, right there. Intervertebral meaning in between, right? So in between the vertebra, there's a foramen in between the vertebra, and this is now where the spinal nerves is going to come out. Okay, so spinal nerves will come out from here. And as I mentioned, we have the spinal cords that is going to be located in here, in the vertebral canal. All right, so that is the vertebrae right there. Next slide here shows us the rib cage. So now we are looking at it from the anterior view. So the rib cage right here, this is composed of the thoracic vertebra posteriorly. So this is the one from the back that we just talked about. Contains the ribs right there. So this is the ribs from the posterior all the way to the lateral and a little bit of the anterior portion right over here. And their associated cartilages. So these white ones right here, these are your cartilages, or specifically known as your costal cartilage right over here. So ribs associated with this costal cartilage right over here. When we are talking about the ribs, now, what is the function of the ribs? It protects the heart and the lungs. We mentioned this one already, right? One of the function of the bones is to protect the heart and the lungs. And now, specifically, we're looking at it at the ribs right over here. There are 12 pairs of ribs total, all connect directly to the thoracic vertebra in the back. So remember this articulation right here, okay? So that's where the connection is. All 12 of them will connect to this articular facets for the ribs. The next one over here is the other structures or that we have here is it also articulates with the body and transverse process of the corresponding thoracic vertebra. So that's the same thing as saying this. All connects directly to the thoracic vertebra. Now specifically though, where do they connect? The body of the vertebra and the transverse process of that vertebra. So going back to the slide here again, the body, this is the body right over here, right? And the transverse process right over here of this vertebra, thoracic vertebra. All right, so we have 12 total ribs and there are specific names for them. We call them the true ribs right over here. The first 7 ribs are known as true ribs, and we have the false ribs, the last 8 to 12 ribs right there. So why do we call them true ribs? They are called true ribs. So this one over here, okay, let me count it here. 1, 2, 3, 4, 5, 6, 7. So the first 7 ribs are true ribs because they have a direct connection. There goes the direct connection of rib number 7 to the sternum. Direct connection right there. Again, and finally the last one right there. So they are connected directly to the sternum by the hyaline cartilage known as your costal cartilage right there. Okay, so that's what we have right over there. Now the false ribs on the other hand, here 8 to 12, they are divided into 8, 9, 10, and 11 and 12. Okay, so these are all false ribs, but these last 2 ribs right there, rib 11 and 12, has special name for them. They are known as your floating ribs. So these are known as your floating ribs, rib number 11 and 12. Okay, so why are they called now false ribs? So 8 to 12, bottom line, okay, 8 to 12 do not have a direct connection to the sternum. They are not directly connected to the sternum. Okay, 8, 9, and 10, they are indirectly connected to the sternum. So not directly, but these are indirectly. So indirectly connected to the sternum. What do I mean by that? So let's take a look at this one over here. So we have, this is number 7, 8, 9, 10, right? So still have the costal cartilage of the 10 right here. You still have the costal cartilage of the 9 right over here. So 9, 10, and 8. They still have their own costal cartilage. However, 8, 9, and 10 have a connection to the sternum via the costal cartilage of number 7. So therefore, they are indirectly connected to the sternum. Okay? Number 11, right here, and number 12, right over here, there's no connection whatsoever. So these are known as your floating ribs. All right, so that is our ribs right there. What are the other structures that we see here? So we also see here the sternum. So this is our sternum right here, the front, right? And we have 3 parts of the sternum. So this has the manubrium right here. You have the body, and you have the xiphoid process right over here. So this, the connection right over here, this is known as the connection of the manubrium and the body. This is known as the sternal angle, and this is actually an anatomical landmark that is used when they are taking an EKG to individual. Okay, so what do I mean by that? So they need to palpate this part right over here so that they know where to connect the leads. So in physiology, I talk more about the EKG machine. So they will be putting the leads here, 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 and here. So 1, 2, 3, 4, 5, 6. So that's where the leads is going to be. And in order for them to figure out, they have to palpate this, and they put it in between the ribs right over there. So that's your that's your sternal angle right over there. And also the sternal angle, that's where rib number 2 is connected. So if you're counting the ribs, if you palpate the sternal angle, then you know that you're in rib number 2. Okay, so that's the manubrium right here. Then you have the body, second part, and then you have the xiphoid process right over here. And the xiphoid process actually does not get calcified until the person is in their fifth decade of life. Okay, so in their 40s. So that's the different parts right there. All right, continue on here. Our next slide here. So once again, this is the breastbone. So along with the ribs, it helps protect the heart and the lungs. So we already mentioned that, right? So it makes this cage. So composed of three bones, manubrium, body, and the xiphoid process. I mentioned this one already. Manubrium articulates with the clavicle. So here is the manubrium right over here. And then this is where the clavicle would be articulating with. So that's where the clavicle is, right there. So this one here on this side, and we have this one right here on this other side, right over here. So that is the clavicle. So it articulates with the clavicle, that's your manubrium, and manubrium also joins with the body of the sternum at an angle. So remember the sternal angle that I mentioned. That's what we have right over here. Counting the ribs is sometimes done to determine where the apex of the heart is located, meaning where is the tip. So this is the tip. So if I draw the heart here, for example, so here's the heart, and the apex, this is the apex or the tip of the heart right over there. So usually between the fifth and the sixth ribs. So the apex here, this is going to be located on the fifth ICS, intercostal space, left mid clavicular line. Left mid clavicular line. So fifth ICS, left mid clavicular line. So that's the apexes. Now this is important as the normal where you find this apex here, because this is when it is misplaced or displaced, it's no longer here. That means it could be an indication of an enlarged heart. Okay, so that's what we have over there. So the xiphoid process is the third part over here, which is an attachment site for the diaphragm. So the diaphragm attaches here. So the diaphragm would be over here and would be attached to the xiphoid process right there, separating the thoracic cavity from the abdominal cavity. So now you have the thoracic cavity here, and down here you have your abdominal cavity. Okay, so that's the sternum right there. Next slide. So this is now going to be the start of the upper extremities and the pectoral girdle. So when we talk about the girdle, this is the one that attaches the upper and the lower extremities. So specifically, pectoral girdle will attach the upper extremities, and the hip girdle, it will attach the lower extremities. And I will continue this in our next series of our lecture.